Yes.
Let me have your attention, if I could, for a moment. We wanted to start this where we can keep on time. We're already a little bit behind, and Ms. Hughes is going to come up and present on the medical board. Ms. Hughes, the mic is on.
Thank you, Mr. Chairman. Mine is very short. I provided a handout. We're discussing line 97.3 to implement Georgia Pain Clinic Act. So we're requesting $115,109, and we provided facts about how many pain clinics we've licensed so far, and we're requesting that line item to hire an agent to inspect these pain clinics and an application specialist to process the work.
You weren't kidding. It's short and sweet. I guess I don't have to worry about members asking questions since nobody's here yet. Maybe that's a good thing. We keep rushing. I did have one question that I really want to know. How does your agency coordinate with the Drugs and Narcotics Division at all as far as pain clinics are concerned? Can you give me sort of a brief overview of that?
Yes, sir. When we first started and the law first passed, we did not have GCIC clearance. So we used Georgia Drugs and Narcotics to run background checks for us, and sometimes we still use them for that. We work with them to inspect pain clinics. If our agents go into a clinic and there's a lot of drugs there, we are trained. We have medical board trained agents, but not pharmacists, which Georgia Drugs and Narcotics are. So we work with them to go over to those clinics with us, and we also share information about cases. They help us work some of our investigative cases dealing with a large amount of narcotics.
Thank you. I appreciate it very much, Ms. Hughes. Thank you for being here today.
Thank you.
All right, Sherry, I appreciate you being here today. If you would, the Board of Physician Workforce. Go ahead.
Okay. Do you just want me to go down the tracking sheet? Or?
However you want to do it.
Okay, I'll just use the tracking sheet on there. For administration, there's some statewide changes with employees' retirement and merit-based pay adjustments. And then there's also an increase that the governor and House both agreed to for maintenance fees for our Georgia Physician Careers website. And that's all under our administration program. Next, under 92.1 is our graduate medical education program. We have increased 5 new family medicine slots at Gwinnett Medical Center. We started working with them several years ago on new program development, and they have their first residents coming in July. And there's also 92.2, where we're using some existing funds we have that's unallocated under our GME to complete the funding of that. 92.3, increased funds for 6 additional family medicine residency slots at Houston Medical Center. This is the 3rd year of funding for them. 3rd year their residents are coming in, so that just makes them whole on that $123,924. 92.4, this is an adjustment the House put in. Increased funds for all Georgia Board for Physician Workforce capitation residency grants by $333 in state funds. And that's all the changes under our GME program. Next, we have our Mercer School of Medicine operating grant, 93.1. The House put in $1,800,000 increase for their operating grant. Next is 94.1, the Morehouse operating grant. The House put in $5 million increase of funds for the Morehouse operating grant. Then we have our Physicians for Rural Areas program, 95.1. The governor put into our budget an increase for 1 additional loan repayment award of $20,000. The House increased this to 13 additional loan repayment awards for $260,000. Our last program is our undergraduate medical education program, and there were no changes recommended by the governor or the House for that.
if I can get this to work. Thank you, Sherry. I had a couple of questions, not in any particular order, but when was the last time we increased capitation funding for medical residents?
The capitation funding was increased in the fiscal year 2009 budget, and right after that went into effect is when the economy started going down, and that increase never actually went through because in the amended budget, it was actually reduced. And the example I can give, we had family medicine in the original 09 was supposed to be $22,000 per resident, and currently it stands at $17,900.
So it's been 5 years, 6 years? Okay. Can you sort of give me a brief overview? Because, I'm really interested in this area, as you know, and we've had those discussions, but can you tell me what some other states are doing that have similar programs, how we are keeping up, maybe the Southeast? That information I'll have to get to you. There are some states that provide state funding for their GME through various sources, but I'll get that information to you. Yeah, I'd like to know
possible.
how we stack up with other states with similar programs to Georgia. If you can sort of make that comparison, that'd be helpful.
Okay, I'll do that.
Because we need to look at that. Also, sort of along those lines, what are the other states doing on loan repayments per year? How do we stack up there?
We're currently offering $20,000, and our board reduced that from $25,000 to stretch our allocation out.
Right.
And other states, surrounding states, they have some similar programs where they offer anywhere from $25,000 to $35,000, and then several of the states use the National Health Service Corps or the Federal State Loan Repayment Program, and those awards run around $30,000.
Okay, so we're lagging behind is basically what I'm driving at.
Right.
Thank you. Real quickly, because I'm concerned, I really appreciate Mercer's medical school. I think they do a great job. Being from South Georgia, we send a lot of students there, and I know their mission's important for the rural areas of Georgia. When was the last time Mercer had an increase in their funding beyond restoring the 2 or 3% cuts? When was the last time they had an increase?
They actually had an increase in 2013 of $800,000 for class size expansion, but prior to that, it was 2008.
So you have to go back. I thought it was further back than that.
It could have been 2000. I just went back as far as 2008, and it was the same as 2009.
Obviously, the point I'm driving at, they've not had an increase in quite some time.
Quite some time, that's correct.
And I understand this new money is to go to the Savannah campus, is that right? The 1.8?
I've not had conversations about that, but that's probably true, yes.
But the point I'm making, though, is it's been a long time since they've had an increase. One last thing, Morehouse. How much do you estimate they might lose in federal funds in the future? Can you do that?
If their federal funds are totally taken away, they would lose about $21 million on that if they totally go away.
Okay. Obviously I have concern and have exhibited that concern last year for Morehouse and for Mercer. But I appreciate, Sherry, very much work you do, and thank you for being here today.
Thank you.
I don't guess I have any members have showed up yet. All right, there's the commissioner here. Commissioner Reese. I'm sorry, I had to put my glasses on to see you. I'm getting old. Not getting old, I am old. I could make Senator Burke, I guess, ex officio. Commissioner, thank you for being here. And,
yes, sir. Thank you.
I say to you what I've said to former commissioner last year. You got one of the toughest jobs in state government. And but having said that, we're going to make it tougher, right?
Yes, sir.
But the mic's on already, so
okay.
Welcome. I'll let you go through, and then I may follow up some questions.
Absolutely.
Jennifer, do we know how to?
Okay, all right. Okay. Thank you, Mr. Chair. Thank you for the opportunity to be here today to present fiscal year 2015 Department of Community Health budget. We'll concentrate on Medicaid, and also talk a little bit about the state health benefit plan. I'll go through and I'll reference the governor's recommendation. I'll reference the House, any changes they might have made to the governor's recommendation, and then also, if you'd like, reference where these items are on the Senate tracking sheet. So let me just start with item 1 on the presentation that we gave you. This is 88.4 and 89.4 on your tracking sheet. This is $29.3 million to provide funds for the new federal premium tax imposed on our CMOs by the Affordable Care Act. Number 2 and 88.6 on your sheet is an increase of $28.275 million to account for our having to move to 12-month eligibility reviews for low-income Medicaid. Number 3 is a small amount of state money, $1.1 million. This is 88.5 on your tracking sheet to account for increase in payments for a premium tax liability that the CMOs will incur as a result of the primary care physician rate increase. Number 4 is $40.9 million. This is 88.3 and 89.3. This is to what we call the woodwork effect, to increase funds for Medicaid eligible children that will come back to Medicaid from Peach Care as a result of the Affordable Care Act. And there may also be some adults that are impacted as well as we go forward. Number 5, our HP vendor, MMIS vendor pays, we pay them on a per member per month basis. So as we enroll new members in Medicaid for whatever reason, this 1.69 is to reflect increased cost for us to pay Hewlett Packard. We go over to number 6. Here we have, this is 87.6 in your tracking sheet. We have an increase of $500,000 to account for prisoners coming out of the Department of Corrections who are medically fragile, who are now served through the correctional healthcare system, and they will be eligible for Medicaid in private nursing homes. Number 7 is a rate increase for nursing homes. This is $13.5 million, 87.7 on your tracking sheet. This will really account to about a 3.3% rate increase for nursing homes using the 2012 cost report and their fair rental value methodology. Number 8 is what we think would be a savings of $680,000, which is an improvement to our MMIS system, which will allow us to keep better track of physician injectable drugs and how much we pay for those. This is the first item, number 9, where we have a little bit of discrepancy with the House. We had in the governor's budget projected savings of $2.6 million to allow us to use what we call our PARIS system, which stands for Public Assistance Reporting Information, and this is a system we thought will help us determine if we are paying for folks who may be eligible for VA benefits or may be eligible in other states. The House projected a savings of $3.4 million. We think that's a little high, and we're not certain that we will make that number because this system is not fully operational, so we would recommend that we go back to the governor's budget of 2.6 projected savings for that category. Number 10, we've talked about how we settle up with hospitals every year, whether we paid them too much or too little. And in 2014, there was an elimination or a cut of $10 million for our funds to do our hospital cost settlements. The governor's recommendation was to give us back $5 million of that for 15. Number 11, here we have, this is an amount of money to reflect growth in the Medicaid program for fiscal year 15. The discrepancy here between the governor's recommendation and the House is that we had $44 million in the governor's recommendation, but what the House did was take out about $3.6 million to have a separate line item for the Planning for Healthy Babies waiver. So it's in another item, and I'll get to that later, but that's the difference in the numbers there, so we don't have any issue with that at all. Number 12 is to reduce funds, reflect a savings of over $69 million where we have a more favorable FMAP percentage. So the state's percentage, or the federal percentage, will go up a little bit and allow us to save state funds to the tune of a little over $69 million. Number 13, this is a result of Senate Bill 24 in 2014, where we for the first time provided for upper payment limit payments to private hospitals. So we have that 25.3 figure there. Number 15, this is 5.1, or let me go back to number 14. This is a transfer of funds between DBHDD and Department of Juvenile Justice for us to begin to serve foster care children, selected DJJ kids, and adoption assistance kids on managed care through a mayor group. And this is a transfer of money from those budgets to allow DCH to administer that. Number 15 is related to that. We'll have to pay run-out claims for foster care kids that are currently served through fee-for-service. So we have $5.1 million associated with that. Moving over to number 16, this is where you'll see the House broke out a separate line item for the Planning for Healthy Babies waiver. This is funds used for prenatal care for Medicaid-eligible members at risk of delivering low birth weight babies. So as I said, we're fully supportive of a separate line item for that. Number 17, this is an item that was not in the governor's budget. This is about $1.281 million, number 88.15 in the Senate tracking sheet that would require CMOs to pay supplemental drug rebates. So we would prefer to go back to the governor's recommendation and not charge those rebates to the pharmaceutical companies for the CMO work. Number 18 is to transfer funds from the Department of Community Health to Public Health for oncology research and education. This is $225,000, and we certainly have no issue with that, if that's the will of the General Assembly. Number 19, this is where the cost settlement. So the governor's recommendation was to give us $5 million back from fiscal year 2014. The House then, in turn, said they wanted to reduce that to $500,000 as opposed to $5 million. So that's this additional savings here that they are projecting of $4.5 million, and we would recommend or ask respectfully that we be able to go back to the $5 million that was in the governor's recommendation. Number 20 is to provide for a 5% rate increase for providers who serve our CCSP and SOURCE clients, our Medicaid waiver clients, elderly waiver programs. This is $566,000 that the House put in, 87.10 in your tracking sheet, and we certainly support that. Number 21, reduce funds to reflect savings through patient-centered outcome incentives for disease management programs. This is somewhat related to our ABD care coordination effort that we are beginning to undertake. The House has projected $3.5 million in savings. We don't actually think we're going to see savings in fiscal year 15. We've got to get this program up and running, select the vendor, and we think it'll actually be a net investment initially. It's a voluntary program, so we don't actually know yet how many people are going to enroll. So we think this may be somewhat premature to take that money at this time. Number 22 is an item to add 25 independent care waiver program slots, and we certainly support that. We move over to 23 through 34. The last items here are going to be administrative items. We have a small savings for an adjustment to our TeamWorks billings, a little over almost $20,000. We have number 24, I should comment on. The House eliminated funding for our contract with Navigant. For those of you who know, we work with Navigant. The department did over the past few years to work with us on Medicaid redesign. Medicaid would like to continue using Navigant to help us with the ABD care coordination model, to help us with foster care transition to a mayor group, and for other future reprocurement of the CMO contracts, which expire in June of 2016. So we would ask that this money be restored if possible. Number 25 is to eliminate funds for one-time funding for 2 FQHCs, which were established fiscal year 2014. So that's a reduction of $500,000. Number 26, I've spoken before that the pharmacy and dental boards were moved to the Department of Community Health last year. They're essentially divisions of DCH. We had originally recommended $1.4 million for their operating expenses. They have advocated for additional funding. The House put in another $247,000 for them, which will essentially equate to 3 more positions to handle licensing for the pharmacy and dental boards. Their volume is extremely high, and we would certainly support that. Number 27 is to increase funds for one-time funding for FQHC startup grants for 1 integrated behavioral health center in Gilmore County and 1 community health center in Clay County. Number 28, to increase funds for area health education center, housing resources for medical students, and 6 weeks rural primary care rotations. That's $300,000. And then there's an item, $50,000 that the House put in for increased funds for the Southeastern Firefighters Burn Foundation. We move over to number 30 on our sheet, number 84.7. On your tracking sheet, this is a $250,000 increase for medically fragile children who may not qualify for our Katie Beckett waiver. Number 31, this is to give $321,000 to our healthcare facility regulation division, which would allow them to begin to license adult day health centers. We had legislation passed several years ago to provide for this ability, but it's never been funded. So this would fund that capability, allow us to hire 2 surveyors to train them, and then begin to actually regulate and survey and inspect adult day health centers. Number 32 is an increase in funds to reflect an adjustment in the employer share, DCH as an employer, of the employees' retirement system of $410,000. Number 33 is to provide funds beginning for fiscal year 2015 of a little over $171,000 for merit-based adjustments and merit increases for our employees. Then we have number 34, finally, our attached agencies. We have a pretty large change here from the governor's recommendation. We initially had about $301,000. That number has jumped in the House recommendation to over $8 million. The primary significant additions there are $1.8 million for Mercer School of Medicine operating grant and $5 million for Morehouse. So, Mr. Chair, that's basically a quick overview for Medicaid, and I can go.
Yeah, go ahead and do your state health benefit plan too, and then we'll come back to questions.
Very good. I won't go through any great detail on state health benefit plan, but I want to highlight a couple of things. One, on the sheet that we've provided to you, and also 90.1 on your tracking sheet, I'd like to recognize that we have a figure there of $2.4 million to begin to cover autism. Now that figure will probably be subject to change because we'd have to come up with a plan design and determine what is the universe of children who are covered under the state health benefit plan who have autism, and what benefits we would offer, what services we would offer under the plan. So this is essentially a placeholder to begin to do that, but I wanted to recognize that this is something new for us. Also, number 2, we would have an increase of $853,000 to increase funds to provide coverage for hearing aids for children effective January 1, 2015. Currently, coverage is capped at $1,500. This would provide increase to cap coverage at $3,000. Many of the next 6 or 7 items for the state health benefit plan are just reflections of amounts required by the Affordable Care Act, such as covering children up to age 26, 100% coverage for preventative care, et cetera. Let me also reiterate that, as you know, we had projected a certain savings for plan design changes for 2014, more cost sharing and higher deductibles for our members. We've gone back and added in copays in order to give some financial relief to our members. So some of those numbers are reflected here. We're going to use reserves for that, so there'll be no cost to Blue Cross Blue Shield, and no cost to our employees or members of the plan. The last thing I'll highlight here, last couple of things for the state health benefit plan. There's been a lot of talk about only having one vendor, Blue Cross Blue Shield of Georgia, for our third-party administration. The House has put in a yes recommendation that the Board of Community Health shall contract with multiple statewide and regional vendors for calendar year 2015. All those things are under active consideration as we speak. We don't necessarily think it's required that it be in an appropriations bill because we're mindful of the concerns that people have on that issue, and we do plan to address that in some form or fashion, but the House did explicitly put it in. And then finally, let me say that under our current structure, current financial posture and direction, we have a reserve balance of about $380 million for fiscal year 15 for the plan. This will go down to around 116, which is a reflection of our bringing back co-pays and funding that through reserves. On our current path, we'll be back in a deficit fund reserve balance position in fiscal year 17. So, Mr. Chair, that's our presentation. I'd be happy to answer any questions.
Thank you, Commissioner. Let me, since we're on the state health benefit plan, let me start there with a question. And
Okay.
I assure you, one of the reasons we're here today is to clean up what the House messed up in here, so we'll go to work on that.
All right.
Let me ask you, because, I think you may have, if you read the newspaper today and if you've been following anything in my life this session, as autism's been a part of my
Yes, sir.
service this year as chairman of Insurance and Labor. So I have an interest in the subject matter, to say the least, and I was pleased the governor put the money in the budget for the state health benefit plan to cover autism, because I've always advocated that if we're going to ask the private sector to do it, state should step to the plate.
Right.
But having said that, do you know if any other state health plans cover autism in other states?
I do not, as I stand here, but we can certainly find out for you.
I'd really like to know, because, Georgia may be a pioneer in this, and I'm sort of curious where we are and where we stack up with other states. I'd really like to know that.
That's right. Okay, we'll find out for you.
And as you progress on autism, I know you got a lot of work to do. Keep me in the loop.
Absolutely.
I'm very interested in that subject. Get more interested by the day. I'm not sure where to start. I guess let me ask about the Board of Dentistry and Pharmacy, since I know we moved that over to your jurisdiction last year, and
Okay.
you're now in charge of that. Are they fully staffed right now?
I think they would say to you that they could always use more people. I think they're doing what they can with the resources they have, but certainly I think this extra $247,000 would help them be able to do their work better and quicker.
Well, that's going to be an area I may follow up later with you
Okay.
in your office to
All right.
get some additional information, if you don't mind, in that area. You mentioned the Paris program, and I know we've been discussing that some time, so this is nothing new, but when do you expect to have it fully implemented? And basically, can you tell me how that's going and what's going on with it?
May 1st of 2014, but I don't think we won't have the full fiscal year impact, so that's why we think maybe a little bit too much is projected to save for this year.
But you think it's
But I think May 1st is our goal to have it fully operational.
May 1st of
Yes, sir.
this year?
Yes, sir.
Okay. Another area, too, I'm sort of concerned about is the adult daycare licensing program.
Right.
How long do you anticipate for getting that fully operational?
We project a time period of 6 to 9 months to be able to hire surveyors. We had draft rules from several years ago that will have to be sort of revamped, brought up to date, promulgated. That's a 2 or 3 month process to get administrative rule effective. Then to train the staff to go out and inspect and survey. So it will take a little bit of a ramp up period.
How many centers, do you have any idea how many centers are we talking about in the state?
I think we've been given some figures by folks who work in the arena of about 150. I've seen a number of 200, so I think within that delta, that's what we're talking about.
I'll follow up later with some other in that area. I do want to ask, because this is an area I really have a lot of questions, but the CMO supplemental drug rebates,
Yes, sir.
are we collecting rebates now?
Not for CMOs, for fee-for-service, but not for managed care.
So we're not, if I heard that right, not from
We are not.
CMOs. We're not currently collecting that right now. Can we really implement this program in 2015?
Supplemental drug rebates?
Right.
I don't know that there's an issue for us procedurally. I think it's a relatively small amount of money. There was some concern about the burden, as it were, on the pharmaceutical companies. But that's really our concern. I don't think it's really a concern of operationally being able to do it.
I mean, it's a good bit to gear up for that, isn't it?
I'm sorry?
Wouldn't it take a good bit to gear up for this, to get it operational?
Well, we do it so much and on such a large basis on the fee-for-service side. I don't really think it would, we'd have to have a system change, and that's always an issue with our vendor. Sometimes that's problematic, but
Can you walk me through that?
I don't. Well,
What
anytime
steps?
we have any change in payment rates or system changes, we have to go through Hewlett Packard, our MMIS vendor, Medicaid Management Information System. They have a queue of projects that they work with us to make changes. This would go in the queue, so probably that would be the thing that affected the time period the most.
How many states are doing this now?
I don't know that, but I can find that out.
I don't think very many.
You may be right.
But I'd like to know, because my understanding, not very many states are doing this, and I'd like to know the exact number, if that's possible.
We'll find
And I
out.
need that soon.
Okay.
I will follow up with you more on that too at a later
Absolutely.
date, because I really have some concerns in that area. Last, let me ask you, and I guess no members have showed up yet, so I get to hog the show here, but the Katie Beckett waiver program, how many would this new contract serve? And that's an 84.7, if you need to look at that.
I think this is, let me find that. What page is that on? Let me see if I can find that again. Okay. The 250,000, we think that would serve about between 150 and 200 families.
You got it, page 4? Page 4?
Okay. Well, I'm looking at, I think it's the 250,000. These are
Right.
for children who who don't qualify for Katie Beckett waiver.
That's right.
So we think about 150 to 200 families will be impacted by this money.
Okay. Commissioner, I guess, and no other people came in. I will remind you about, since Senator Burke's here, we've had that conversation about credentialing, so while I got you in the podium, please remember to follow up with my good friend, the senator from my
Yes, sir.
adjoining district. I do have an interest in that issue as well,
Yes,
because
sir.
I hear from
As do I. We need to do that better, and we're aware of that. Thank you.
With that, I think I'm known for trying to run a fairly quick meeting, and but we are going to follow up. We do have some other questions
Absolutely.
in all the areas I just went through. But Commissioner, thank you very much.
Okay. Thank you, sir.
And meeting's adjourned.